So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome everyone to our student PowerPoint presentation. Our topic for today is preventing and managing arthritis in low-income communities. Student speakers for our presentation today include Maria Reyes, Kaylnn Pitts, Crystal Rylowicz, Gabriel Saiki, Svitlana Mathany, and our slide contributors are Maria Reyes, Crystal Rylowicz, Kaylnn Pitts, Raven Moore, Robin Jean Lay, and Jayashree Salian. We want to take our time to say thank you to Restream for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it most. Our agenda for the PowerPoint discussion today is arthritis, introduction and types of arthritis, factors contributing to arthritis, including the impact of arthritis on low-income individuals, the importance of regular health checkups, community support and resources, early detection and diagnosis, nutrition tips on a budget, educational workshops and events, and overcoming barriers to care.
What is arthritis? Arthritis is inflammation or swelling of one or more joints. It's referred to as arthritis. It covers over 100 disorders affecting joints, surrounding tissues, and other connective structures. Depending on the type of arthritis, there are different symptoms, although joint pain and stiffness are typically present. Types of arthritis. 1. Osteoarthritis affects hands, hips, and knees. 2. Rheumatoid arthritis is autoimmune and inflammatory. 3. Gout affects big toe joints. 4. Fibromyalgia affects body pain, causes body pain, sleep problems, fatigue, and mental and emotional distress. 5. Childhood arthritis can cause permanent physical damage to joints. Factors contributing to arthritis. Non-modifiable risk factors are risk factors that you cannot control. This is from the Center of Disease Control and Prevention. Non-modifiable risk factors include age. There's an increased risk of arthritis as you get older. Other non-modifiable factors include gender. Most types of arthritis are more common in women. Gout is more common in men, and osteoarthritis is more common in women. There's also the genetic modifiable risk factors, where individuals can be born with specific genes to develop certain types of arthritis, such as rheumatoid arthritis or systemic lupus erythematosus, SLE. Making lifestyle changes can decrease your risk of getting some type of arthritis or making arthritis worse. Centers for Disease Control and Prevention, 2023. Risk factors that you can control include obesity. Here, individuals who are overweight or obese are more likely to get knee osteoarthritis. Another one is infections, where many microbial agents like bacteria and viruses can affect joints and potentially cause the development of some types of arthritis. Also, you have joint injuries where joints can be damaged and contribute to the development of osteoarthritis. Lastly, there's smoking. It has been shown that cigarette smoking increases a person's risk of developing rheumatoid arthritis. The impact of arthritis on low-income individuals. Barriers to healthcare access. Low-income communities often face challenges in accessing healthcare facilities and services. Limited availability of affordable healthcare providers, transportation issues, and long waiting times can hinder individuals from seeking timely medical attention for arthritis. Another impact is the financial implication. Arthritis requires ongoing medical care, medications, and sometimes surgeries. The cost of prescription medication, physical therapy, assistive devices, and potential surgical interventions can strain the limited financial resources of individuals in these communities. Importance of regular health checkups. People with arthritis are prone to developing other serious chronic diseases such as heart disease, diabetes, kidney disease, and lung disease. Regular checkups are important for the following reasons. 1. Early detection. 2. Preventive measures. 3. Effective treatment planning. 4. Monitoring disease progression. 5. Quality of life improvement. And finally, patient education.
Access to affordable medicine. Utilizing generic medications enables individuals with arthritis to economize while obtaining effective treatment, as these drugs contain identical active ingredients to their brand name counterparts. Prescription assistance programs, accessible both in physical drugstores and online through reputable companies, necessitate a valid prescription and yield substantial cost savings for consumers amounting to thousands annually. Community health clinics adopt sliding scales for healthcare, providing visits with healthcare providers that may include complimentary samples of brand name medications. Clinic support staff facilitate connections to other professionals, services, and healthcare providers. Community support and resources include participation in support groups, advantages for arthritic individuals, the sense of community aids in coping. Groups available both online and in person offer guidance to those living with arthritis. 2. Nonprofit organizations like the Arthritis Foundation, established circa 1940s, contributed to managing arthritis-related treatment and expenses. The foundation offers a helpline and valuable information to those seeking assistance. 3. The Centers for Disease Control and Prevention Arthritis Program stands as the singular federal initiative exclusive to arthritis. Through data collection, it aims to comprehend arthritis rates, trends, factors influencing quality of life, and provide supportive resources. Building a supportive community. Number 1. Community building events, including walks, dinners, and game nights, play a pivotal role with connections in cultivating ties within the arthritis community. Networking events bring new life, ideas, and energy into the community. 2. The act of sharing success stories among individuals with arthritis humanizes their experiences, conveying powerful messages, raising awareness, and extending support. 3. Narrating personal stories related to arthritis fosters understanding and empathy within the community, establishing a space for the exchange of coping strategies and emotional support. Sharing these stories serves to decrease feelings of isolation, build communities, and strengthen mutual support.
Early detection and diagnosis. Doctors usually diagnose arthritis using the patient's medical history, physical examination, x-rays, and blood tests. Key aspects of early detection include symptom recognition. Early symptoms include joint pain, swelling, and reduced range of motion. Blood tests. Tests can check for specific markers. Medical history. Provider will take a detailed medical history, including family history of arthritis. Lifestyle modifications for prevention and managing arthritis. The following lifestyle changes can prevent or manage arthritis. Regular exercise. You can reduce risks of developing additional chronic diseases through physical activity. When beginning physical activity, is it essential to begin gradually and monitor your body's tolerance? Arthritis sufferers ought to strive for 150 minutes of physical activity per week. Weight management. Maintaining a healthy weight can help prevent or manage arthritis. Individuals who are overweight may place additional strain on joints, such as knees and hips. Individuals with arthritis may experience pain reduction and enhance physical function through weight loss. Life modifications for prevention, part 2. The following lifestyle changes can prevent or manage arthritis. Healthy diet. A range of healthful foods are part of a balanced diet. Fad diets could seem promising at first, but they tend to be harmful, restrict nutrient consumption, and produce unsatisfactory outcomes over time. Weight management. Maintaining a healthy weight can help prevent or manage arthritis. Individuals who are overweight may place additional strain on joints such as knees and hips. Individuals with arthritis may experience pain reduction and enhance physical function through weight loss. Low-cost exercise options. Low-impact aerobic activities, brisk walking, cycling, water aerobic activities, swimming and water aerobics, home activities, gardening, yoga, and basic stretching, group exercise classes, dancing and yoga, muscle exercises, calisthenics, weight training, and using resistance bands.
Nutrition tips on a budget. The importance of a balanced diet. A balanced diet ensures that the body receives a variety of nutrients that work synergistically. Nutrients like vitamin C, vitamin D, calcium, and omega-3 fatty acids, when consumed together, contribute to joint health. Affordable sources. Beans, lentils, and canned tuna are budget-friendly protein options. Plant-based proteins like beans and lentils are also provide fiber, which support overall digestive health. Additional nutrition tips on a budget. Meal planning on a budget. Prepare large batches of meals and freeze them in portions. This helps save money by buying ingredients in bulk and reduces the temptation to eat out. Purchase fruits and vegetables that are in season and locally sourced, as they are often more affordable and nutritionally rich. Joint-friendly activities. These activities can be done at home and in the community. Brisk walking, cycling, swimming, water aerobics, light gardening, group exercise classes, dancing, tai chi, yoga, social engagement, painting, crocheting, knitting, wheelchair, basketball. Now we have Svitlana presenting.
Home remedies and self-care, heat and cold therapy, staying active. These are things you can do in the privacy of your home that are inexpensive. Insurance may cover massage therapy, psychotherapy, hypnosis, biofeedback, or cognitive behavioral therapy. Stress management, joint protection, such as braces. Educational workshops and events. Support groups can offer personal experience and advice. Coping strategies can be held online, held in healthcare facilities. Events. Walks, runs to raise awareness. Communities, health fairs, guest speakers, social media campaigns, medical screenings. Workshops. Joint-friendly exercises at the gym, community center. Nutrition seminars, stress management seminars. Resources, brochures, posters, online portals and articles, exercises and nutritional recipes. Reputable arthritis organization links. Educational materials, infographics, posters to be disseminated in public, short educational videos on arthritis, newsletters with resources, present this information in schools to children. Overcoming barriers to care. Telehealth. There are different types of telehealth, and each state may have its own rules about how to use them. Telehealth comes in many forms, such as interactive services, store and forward, and remote tracking. Telehealth, the healthcare providers would be able to offer telehealth appointments either through telephone or video meeting or traditional face-to-face appointments. Transportation, the availability of comprehensive care may be concentrated in specific healthcare facilities, requiring you to travel long distances to access the necessary services. Advocacy, some places may make it harder to get an evaluation from a rheumatologist, and the way the healthcare system is set up may also cause these delays. Therefore, it may be important to be your own advocate, or even obtaining a health advocate to address your health needs.
At this time, we would like to open up with our student discussion. Interns, please turn your cameras on at this time. Okay, question number 1. Are there specific lifestyle factors or environmental conditions in low-income communities that contribute to arthritis risk? Yes, several lifestyle factors and environmental conditions prevalent in low-income communities can contribute to an increased risk of arthritis. It's important to recognize the intersectionality with social determinants of health and how they can impact the development and management of arthritis in these communities. Who would like to further comment?
I will say personally, as someone whose mom has arthritis in like her hands, she used to do a lot of people's hair where we used to live. So she used to do a lot of braiding and a lot of using her arms and her hands. So a lot of those type of lifestyle factors, I know a lot of people who do hair and things like that, they start to get a little bit of arthritis in their hands because you're constantly doing that movement for hours at a time. And also I know one time my doctor told me it's important not to crack your knuckles. I know that was like a big thing that people would do was crack their knuckles. But cracking your knuckles can also lead to like arthritis and things like that. So you definitely have to be careful of the things that you don't even think about that could possibly give you arthritis.
I would agree with Kaylin. My dad used to work a lot of field jobs. It's different now. He's not doing that anymore as he got older. But when he was younger and would do field jobs, not only did he develop diabetes, probably from family history, but also arthritis in his knees. So similar to Kaylin, right? Like sometimes the environment that you're working in, your lifestyle, that might contribute to it. And then same thing, my mother also has arthritis in her hands. So that just makes me wonder, like, whatever I'm doing might be also a risk factor as well as hereditary at this point, since my parents also have it.
Okay, at this time, we will move on to question 2. Can anyone get arthritis? Yes, arthritis is a condition that can affect people of all ages, genders, and backgrounds. It is not limited to a specific demographic group, and various forms of arthritis can develop in individuals with different health profiles. However, certain factors may increase the risk of developing arthritis.
Yeah, I totally agree that arthritis is not actually seen in a particular demographic group. But the basic truth is that some demographic group are actually affected more based on their socio-economic life and also their environment where they live, because sometimes there are communities that do not really that do not have provision for physical activities where they can actually, especially in their youthful age, where they cannot actually have something like sidewalks where they can actually walk to keep themselves fit and something like that. So over time, because arthritis comes up towards the older age, but if along the way you don't have some of these amenities within your reach, especially where you have the gym or maybe the community gym on a far place in a far location where they cannot actually access. Actually gives them makes especially the minority population put them at an odd and actually an increased risk of having arthritis over time because it has to do with lifestyle modification. And if you cannot actually access some of these basic amenities, you're actually predisposed to having it.
Are there any other thoughts? Okay. Question number 3. What unique challenges do individuals in low-income communities face when it comes to preventing and managing arthritis? Osteoarthritis is one of the most frequently occurring musculoskeletal diseases, posing a significant public health problem due to its impact on pain and disability. Individuals in low income communities face many challenges when preventing arthritis. Challenges include limiting access to health care, financial barriers, limited education and awareness, workplace challenges, housing conditions, and mental health and stress. Thoughts?
I would definitely agree with that. I was in nursing school for a little bit of time, and we definitely learned about that. And we would see mostly elderly women with the condition. And it just would be like either from years of labor that they're doing, or, a lot of bending and using your back a lot, or whatever their lifestyle was, or just something that happened to them. So it is definitely something that a lot of people don't know it exists, but it's very common to get as you get older. So I think a lot of people should definitely read up on it, because it is definitely something that you do want to prevent.
I agree with Kaylin. I think a lot of factors contribute to this condition and the different types of conditions that there are from arthritis. Like we were saying, a lot of the conditions could be environmental, access to resources, or even access to healthcare or physical activities, things like that are all contributing factors to that. And apart from that, there are other factors that also affect this condition apart from the ones listed here, which I think are important to consider.
I agree with you, Maria, especially like one of the conditions was housing conditions. I also think that um, safe communities, there's a lot of people who aren't able to go out walking or exercising due to the conditions of their communities. If there's any gun violence, obviously kids and adults, anybody wouldn't be able to go out to the parks and exercise as um, we would anywhere else.
Okay, for question number 4, what are some simple things a person with arthritis can do that don't cost a lot of money? Walking, cycling, swimming and water aerobics, dancing, painting, crocheting, and knitting. I will just chime in and say I do suffer from a lot of different types of arthritis. And the one thing that I've noticed is sometimes I can't move my hands, and that takes an effect. You can't do your laundry, you can't cook, you can't clean. So one of the things that does help me is when I feel the stiffness coming on, I always try to, move my hands in some form to keep them busy so that your joints say, okay, they're starting to hurt, there's pain, but we can move. We recognize this. So that does help a little.
I think another aspect is actually lifestyle modifications. Where in cases, one of the problems, especially with arthritis of the knee, is actually the weight actually falling on the knees and actually causing a lot. So lifestyle modification can actually also assist in actually helping um, going through weight loss program and continuous use of that joint instead of staying having to stay in one location, one position for a long period, because there are a lot of people that just sit and they sit for a long hours without moving their body, especially these days where people work with the internet, work from the computers, work from their homes, and they just sit on a particular position for a long hour. This over time actually can actually cause a lot of problem, especially not moving those joints and actually doing those things, moving. So mobility is actually key to actually helping these individuals.
I agree with you. One of the things that one of my workplaces had actually implemented was using medicine balls instead of us having to use regular chairs to help people with arthritis as well as back pain.
Thank you everyone for our student discussion and participating. At this time, we would like to thank everyone else for joining our student team on our topic, Preventing and Managing Arthritis in Low-Income Communities.